Hey everyone, welcome to another edition of Medicare Mondays. I'm your host, Joseph Katz, here again with co-founder Tom Ness. How are you today, sir?
Hey, Joseph. Hi, everyone. Good, thanks.
So, Tom, what I wanted to chat today about is, turning 65, big number, lot to know about Medicare. So would you be so kind as to share a couple of ideas as it relates to what people need to know when they turn 65?
Yeah, gladly. And as we all know, and if you're on our site, you probably know that turning 65 is an important milestone in choosing or enrolling in Medicare. And so the first thing that I really wanted to touch on, Joseph, was to make sure that you don't miss your initial enrollment period when you turn 65. And so that is the 3 months before you turn 65, the month you turn 65, and then the 3 months after you turn 65. And so if you are enrolling in Medicare for the first time when you turn 65, it's really important that you don't miss that window in order to avoid penalties down the line for your Medicare Part B and your Medicare Part D drug coverage.
And as we talked about in the previous video, that could be lifetime.
That's right. Those penalties, they vary between Part B and Part D, but yeah, they stay with you for life. So it's really important that you do take note of those enrollment periods and don't miss them. And we can help you to understand exactly when you should be enrolling. So that's the first thing. The second thing that I think I wanted to point out is, even though you choose a plan to enroll in when you first turn 65, you should still review your options every year. And that's because the Medicare market is getting so big now, with so many people turning 65. There's so many great new options every year. And these new plans have excellent new features that we find our clients often aren't aware of, but can be really valuable and really beneficial. And we want to make sure that everyone's making the most of the Medicare plans available to them. So shop your plans each year. That's another really important thing to remember.
Is the policy, just to be clear, the policy year, the year when you sign up, or is it based on a calendar date?
It's calendar year. So your plan effectively runs for the calendar year from January to December. Now, for example, Medicare Advantage plans, they don't usually like kick you off the plan each year, so you don't have to re-enroll, but you get the option to switch during the annual enrollment period from October to December every year.
Right. So that doesn't matter if you bought your policy in April, May, or June. You have that open enrollment period starting in October.
Right. That's right. And that's for a plan to start on the 1st of January the next year.
That's a very important tip I think people should keep in mind.
Yeah, I agree. And then the third thing, Joseph, is when you're comparing plans, when you're turning 65 and looking at the plans available, you should look at what you expect your costs to be across the full year. You might be looking at a Medicare Advantage plan, and although it has a $0 premium and maybe the doctor copays are low, you have to think about what other healthcare costs you might have during the year, because they can start to add up. If you might have a hospital visit and some lab tests, and you might need something at an outpatient surgery, and so those costs can add up quickly. And what you might find is you might be better off with coverage from a Medicare supplement policy, where you have to pay that upfront monthly premium, as we know, but overall your costs during the year might be lower.
Yeah, and it's obviously hard to figure that out exactly because no one knows what's going to happen to their health. But obviously, if you do know you have something coming up, you could figure some of those things out in advance.
That's right. It can be hard, and we can help you think about that as well, to kind of plan out for what the rest of your year and what the future might look like.
The total costs out of pocket that someone may have on plan one plan versus another plan.
That's exactly right.
So those are 3 good tips. Let's just review them real quick. One is don't miss your open enrollment for your initial enrollment.
Don't miss that 7-month initial enrollment period. That's really, really important in order to avoid these penalties that you can't get rid of. They stick with you for the rest of your life. So it's really important to make make a decision. You have 7 months to make a decision, so you've got time. So that's really important. The second thing is to shop your plan each year, to reshop and check if there's a better plan available. And the third thing is to try and take a longer term view of your healthcare costs and what you think they're likely to be, and use that to help you make your decision on which plan is going to be the most cost effective and the most beneficial for you.
Very good tips, Tom. I appreciate that. Anyone has any questions, they could reach out to hello@coverright.com. We'll be back next week with another video. Feel free to check out our previous videos on our site. You can now go to learning.coverright.com for all of our content in one simple, easy to find and use location. Thank you all for listening. Tom, thanks for your time, and we'll see you again soon.
Cool. Thanks, everyone. Thanks, Joseph.